Hi, I'm Katie, EleMental Health's AI guide. At EleMental Health, one of the most important parts of treatment is making sure we are carefully tracking your progress over time, not just relying on subjective feelings, but using clinically validated tools that help us measure improvement in a meaningful and evidence-based way. Before beginning treatment, and again throughout your course of care, patients complete several standardized mental health screeners. These assessments help us understand where symptoms are starting, how they change over time, and whether adjustments to treatment may be needed. The first screener we commonly use is the PHQ-9, or Patient Health Questionnaire 9. This tool measures symptoms of depression, such as low mood, sleep disturbances, low energy, changes in appetite, hopelessness, and suicidal thoughts. The PHQ-9 gives us a numerical score that helps quantify depression severity and monitor response to treatment over time. We can also use the HAM-D, which also assesses depression using different metrics. We also use the GAD-7, which stands for Generalized Anxiety Disorder 7. This screener measures anxiety symptoms like excessive worry, nervousness, tension, irritability, restlessness, and difficulty relaxing. Anxiety often improves differently than depression, so tracking it independently is very important. For patients with trauma-related symptoms, we use the PCL-5, or PTSD checklist. This measures symptoms associated with post-traumatic stress disorder, including intrusive thoughts, avoidance, emotional numbness, hypervigilance, and trauma-related emotional distress. For suicide risk, we utilize is the CSSRS, or Columbia Suicide Severity Rating Scale. This helps us assess suicidal thoughts, suicidal risk, and overall patient safety throughout the course of treatment. Safety is always our top priority. These screeners are not simply paperwork. They are valuable clinical tools that help guide your treatment plan. They allow both you and your treatment team to objectively see progress that may sometimes be difficult to recognize day to day. For example, many patients notice subtle improvements before realizing how much has changed overall. Sleep may improve first, then energy, then emotional resilience, then motivation or social connection. By comparing scores over time, we can often identify positive changes even before patients fully feel the emotional impact themselves. At EleMental Health, we typically hope to see about a 50% reduction in depression and anxiety scores over the course of treatment, and significant reductions, around a 15-point drop, in PTSD symptoms as well. While every patient's journey is different, these tools help us measure outcomes in a consistent and research-supported way. Tracking progress also helps us make important decisions about maintenance care. If symptoms begin gradually returning, screeners can help identify early warning signs before a patient reaches a crisis point. This allows us to adjust booster timing, therapy support, or treatment approaches proactively rather than reactively. It's also important to understand that healing is rarely perfectly linear. Some patients improve very quickly, while others experience gradual progress over time. Temporary fluctuations are normal. These assessments help us look at the bigger picture, rather than focusing too heavily on any single difficult day or challenging session. Most importantly, these tools allow treatment to become collaborative. You are not just passively receiving care. You are actively participating in understanding your own healing process alongside your providers. We may utilize other screeners that are specific to your needs and goals as well. At EleMental Health, we believe good care should be compassionate, individualized, and measurable. Using validated screeners helps us ensure that treatment is not only supportive and safe, but also effective and accountable, as we work together toward long-term healing and wellness. We are happy to chat at any point during your patient care journey, and can be reached at 208-801-1414.